hope this webinar is useful for your practice as we learn a little bit more about the Latinx community and how can we provide cultural responsive services from a trauma-informed approach. So today we're going to be learning about some of the barriers such as language, socioeconomic factors that affect the Latinx community's access to behavioral health services. Also, we're going to be learning about how can we provide culturally responsive care within a trauma-informed framework, and I will give you practical examples that you can take to your practice. Again, learning objectives for today, gaining an understanding of the Latinx culture, including demographic variations and cultural norms, and learning and using practical tools and strategies that you can tailor to effectively engage with Latinx population, ensuring the delivery of cultural responsive behavioral health services from a trauma-informed care approach. A little bit about me. My name is Aleida Murcia. I have a master's degree in social work and a bachelor's degree in psychology from Cal State San Bernardino. I'm currently pursuing my doctorate degree in social work with an emphasis in trauma-informed interventions. I've been teaching and facilitating trainings for the Child Welfare Academy, now for the Behavioral Health Academy, and also for different universities. My background is in child welfare, and I'm currently working for Kaiser as a clinician and providing mental health and behavioral health services. So it is a pleasure for me to be here today sharing with you, and I hope after you walk away from this webinar, you can learn a little bit more about the Latinx community, and also you can walk away with tools that you can implement in your practice. So first, let's review a little bit. When we talk about cultural responsive practice, what are we talking about? Well, we're talking about one's ability to know our clients' culture. And by clients, it could be the families that you work with, the organizations, the communities, the individual people that you work with, and how their culture impacts their understanding of other people's culture and way of life, right? This is key when we're providing behavioral health services. We also want to have a deep understanding of other people's who they are, right? And therefore understanding the reasons behind the choices they make. We want to recognize others as individuals and effectively communicate with them based on their individual needs in order to provide cultural appropriate services. And this is the focus of today's webinar, understanding a little bit more about the Latinx community, because they have their own challenges. And as practitioners, it is really difficult sometimes to have an understanding of everybody's culture. That's when cultural humility comes in place. I'm not an expert on anybody's culture. I'm not even an expert on my own culture. However, I can do my best to try to learn from others and identify and utilize those community resources available to provide the best care that I can. So the first question to address the Latinx culture is, and I want to give you a few seconds for you to think, what is the best word or term that we can use to refer to this culture, Latino or Hispanic? And let's think about, maybe you have friends, you have clients, and just think about how you refer to them. Do I use Latino or I use Hispanic? And what is the correct term? Well, it depends, okay? So let's take a closer look, and I'm not mean to confuse you. I hope you can remember a little bit of your geography class. And Hispanic specifically concerns to the Spanish language speaking Latin American and Spain. So people who come from a Spanish language country, or their family comes from those countries in Latin America or Spain, we refer to them as Hispanic. Even if the person doesn't speak Spanish, there are a lot of people whose family come from those countries, but they don't speak the language. However, they identify themselves as Hispanic. Latino and Latina concern to those coming from Latin America countries and cultures, regardless of whether the person, again, speaks the language or not. Okay. For example, people from Brazil, they are Latinos, but they do not speak Spanish because they speak Portuguese. And then we have another term that is Latinx. Latinx is a gender neutral alternative for Latino and Latina, and it means to be more inclusive. And we started using that term in the 2000s, and it's becoming more popular. So when you're talking to somebody from the Latinx community, well, you want to explore a little bit more what country they come from or what country their family comes from. Okay, that's when I'm talking to my clients. I always ask that question: what is your family? Well, if they disclose or they identify as Latino or Hispanic, I always ask what is your family comes from. And if they come from Brazil, so we can call, they will be Latino, but they won't be Hispanics because they don't speak Spanish, or they don't come from a country that speaks Spanish, right? If they come from Spain, for example, they are Hispanic, but they are not Latinos because Spain is not located in Latin America. If they come from Argentina, Bolivia, Chile, Colombia, and all these countries, they could be both. Okay. It is a little bit confusing, maybe, but when you and I hope this graph helps you to understand the concept better. And when we're referring to our clients, we can use the proper term. So now let's explore a little bit more about the Latinx culture. It is a very complex culture, so it is understandable that sometimes we are confused. And again, I appreciate you taking the time to learn more about the Latinx culture so you have a better understanding. One of the things that I would like to share with you is a little bit about demographics. The U.S. Hispanic population reached 63.6 million in 2022. That's up from 50 million in 2010. That's a 26% increase in the Hispanic population. In 2022, Hispanics comprised nearly 1 in 5 people in the U.S. That's 90%, up from 60% in 2019 and just 5% in 1970. So that is a huge change. It's a huge growth. And this growth has been influenced mainly by newborns, meaning people being born here in the US, Hispanics and Latinos having babies in the US instead of immigration. And not only we're facing that challenge that this population is growing, so we have more and more clients, especially I live in San Bernardino County, so a lot of my clients and patients are Hispanic or Latinos. But also there is another layer that we add, is that in 2022, 20 million people identify with more than one race compared to 3 million in 2010. So it means that we're dealing with multiracial population. So not only you're dealing with somebody who is from Hispanic descent, but maybe from a mix with other race. And that places another layer of complexity in understanding their cultural background. In 2022, we got this data from 2022. So probably in a few years, this is going to change. And that's important that we always keep up with the research and the new information, because the more the demographics changes, the more we are facing new challenges as practitioners. And that's why we reach out to these type of learning environments and these type of webinars and trainings to be able to have a better understanding and keep up with what's happening, so we can provide services that are tailored to the needs of the clients. So let's move to understanding another important topic when you are talking about the Latinx culture of families from Latino and Hispanic background. One of the big stereotypes is that people think that all Hispanics or all Latinx are Mexicans, okay? And I want to highlight that Hispanics have different origins and backgrounds, and Mexicans are the most predominant group in the US. That's why some people refer to, Mexicans. But Mexicans are just a part of the Latinx culture, but they are not, not all Latinos are Mexicans. We also have, and you can see the numbers here on the screen, we have Puerto Ricans, Salvadorians, Cubans, Dominicans, and the numbers are there for you to see. I'm not going to go through all of them. And this is one of the first things that we need if we have ever referred to, when we encounter a Latino client, are you Mexican? Assuming that the person is Mexican, most likely because of the numbers, they could be Mexican because they are the biggest group here in the US, but not all the time, okay? And that is important to know. Another important factor is religion. Religion makes, and we'll talk about in a little bit. We'll talk about that in a little bit. But that has changed over time for Hispanics and Latinx. 43% of Latinx identify as Catholics, and this has been a decline back in 2010. Or in 2010, 60%, and it has been changing over time. And now we have 50% identify as evangelical and 30% religiously unaffiliated. And this is interesting because the Latinx culture, for them, religion is a big part of their culture, but that has been changing over time here in the United States and also in their countries of origin as well. Let's talk a little bit about language, which becomes a huge barrier when receiving services, okay? People who, first generation coming from their countries and they don't speak the language, they speak English, it becomes a challenge for them to access services. Sometimes they don't know how to communicate. They don't know maybe that they're entitled to having a translator. And even when you use a translator, it's not the same, right? I am bilingual. Spanish is my first language. And so I have been a translator many times for my colleagues, and it is not the same when you're translating or when you are sharing your feelings. For example, you're in a therapy session, you're in an intake session, and you're communicating in your language, and somebody else is translating for you. In the past, my experiences when the translator is not well versed in the language, they cannot communicate what the person is saying, which becomes a challenge. And it's nobody's fault. It's not the practitioner's fault. It's not the person receiving the information, because they are using a translator, because they don't speak the language. So this becomes a challenge. So we need to be very mindful. English proficiency has increased in Spanish speaking homes, meaning more parents are learning the language. So children, has Spanish use has decreased, which, I mean, it's part of being raised in a home, with parents who speak the language. For example, if back in the day, if parents who immigrated here didn't speak English, or didn't learn English, didn't feel the need to learn the language, so their children were kind of forced to speak both languages, right? At home, they had to speak Spanish, and then at school and with friends, they learned to speak English, and they grew up to be fully bilingual. So we have a generation of fully bilingual children. That has changed a little bit, because parents have felt the need to learn the language, to learn English, to communicate better, to be able to access resources in the community. So now we have a generation of children who understand the language, understand Spanish, but they don't speak it, right? And maybe some of you identify with that, or have your own children, or some friends who have children who understand Spanish, but they don't speak it. So again, when we provide services, it's very important to have this in mind, that language could be a huge barrier, a huge reason why people don't reach out for help. And now we're going to move a little bit to talk about cultural norms. And I want you to open your minds and learn a little bit more about the Latinx community, and how this perception of culture can impact the services that we provide, or the relationships that we have with our clients, okay, or our patients. First of all, the Latinx have a different perception of personal space and affection. Latinx are very affectionate, and they love hugs and kisses. So it is common that and I don't know if it has happened in your own practice, that sometimes when people feel really thankful for your help, or they feel understood or supported, they tend to give you a hug, or shake hands, and get closer to you, because that's one way of showing affection. And sometimes that could be a little different if we are from a different culture. The concept of personal space is not very important in the Hispanic Latinx culture. Growing up in Colombia, I never learned about that concept. And when I came to the United States, I quickly had to learn that it's very important in this culture to respect personal space. I cannot get very close to other people, because that could be disrespectful. And children here, if they learn that in kindergarten. They learn that you have to respect their personal space and your personal bubble. But for Latinx, that's not a concept that is ingrained in their culture. So just have that in mind. We're working with them. They don't mean to be disrespectful or get into your personal space. That's not a concept that is very important in the Hispanic Latinx culture. Um, time, time and space again. Time is Latinx are very flexible with time. And for example, the party is at 5 p.m. No one will show up at 5. Okay, people show up at 6, 7 p.m. And usually Latinx celebrations, they don't set up like ending time. It's like 7 p.m. to who knows when it's gonna be over, and that's part of the culture. When they say I'll be there in 5 minutes, estaré ahí en 5 minutos. Well, those 5 minutes could be 20 minutes, 30 minutes. It could be an hour or two. Okay, like ahorita voy. I'm going right now. it could be that they are still home and not going anywhere, okay? But they want to go, but they're not going yet. So what this is important, because when you're working with Latinx clients, they may show up late to their appointment and then don't mean any harm and any disrespect. It's just part of the cultural norm that they are flexible with time. So having that understanding maybe can help us, and maybe setting those boundaries with them from the very beginning, saying like, hey, we have back to back most of the time appointments, and I really need you to be here on time, but also being understanding if that's not the case. Let's talk about food. Sitting around the table and chatting when sharing meals is essential for the Latinx community. Families enjoy getting together for the holidays, they enjoy cooking and eating big meals. Sometimes, if you ever work and you have to do home visits, maybe somebody's going to offer you some food, and that's a way of saying thank you for being here, thank you for helping us. It's part of the cultural norm. So it is important, how do you handle that? Because most organizations have a policy against, and it could be seen unethical for you to receive food or eat something that your client provides to you. But then having that understanding of the culture, it is important as well. So you can be thankful, maybe say something like, I'll take it to the office or something like that, because you understand that is part of their cultural beliefs. Well, let's talk about family first. Family is central to the Latinx culture, and we're talking about nuclear family and extended family. It is common for families to live together or nearby in the same neighborhood, same city. Children are not expected to move out by 18. For Latinx parents, it's okay for children to stay there past 18. And many children stay with their parents until they get married, or start their own family. And sometimes they get married and they still stay with their parents. Or they move back. It's very common for that. Well, this is a strength when we're working and developing support systems for the family, because we can include that extended family. Sometimes it could be also an issue with boundaries, and because there is a lot of enmeshment in Latinx families, and so that could be complicated at times as well. But from the strength-based perspective, it's a good thing when you are developing support networks for your clients. Um, okay, Latinx love to sing and dance. They're not afraid of moving their hips or doing karaoke at parties. It's part of the culture. Sometimes there are some cultures that are a little bit louder than others, and that's part of who they are. Okay. Also, beliefs and spiritual traditions are very important for Latinx communities. For example, Latinx tend to believe a lot about on the supernatural, and that's part of their culture as well. And when providing services, we have to be understanding of those beliefs as well. Um, Religion and spiritual traditions are important. And for example, Mexicans, they celebrate El Dia de los Muertos in November, and that's a very important cultural tradition for them. Politics and authority, Latinx perceive politics and authority in a little bit different. They do respect a lot figures of people of authority, and sometimes they even refer to you. I don't know if it has happened to you, those who provide direct services. Like, oh, doctor, doctora, even if you don't hold a doctorate degree. And even if you explain to them, I'm not a doctor, I don't have a PhD, I don't have a doctorate, they will keep calling you like that because that's a way of showing respect to you. With politics, again, a lot of Latinx members of come from countries that had suffered a lot of political issues, social issues. So they are very distrusting of the government agencies, which it plays a huge challenge when providing services if we represent a government agency. I used to work for the Children and Family Services Department in San Bernardino County. And initially, when I started working with them, and I used to, go out to do my home visits and my investigations, people were very distrusting of me. And I took it personal. I was like, but I'm trying to be very nice, and I'm not here to cause any harm to anybody. But why are people so distrusting? But it wasn't personal. It wasn't about me because they didn't really know me. It was about the system that I was representing. I was representing the Department of Children and Family Services. That's a government agency that happens to have questionable reputation, unfortunately, in the media and in the community. So it was hard for people to open, their doors and welcome me in their home because they were worried about what was the reason I was there. I was there to remove the children. I was there to do something to them because I was representing a government agency. So we need to be mindful why sometimes Latinx are afraid of receiving services, afraid of reaching out, afraid of following through with their case plans, with the treatment plans. Well, sometimes it's because they are afraid that we are going to betray them or the government. And again, let's let's try to think a little bit about where they're coming from or where their families come from and why they have this distrusting relationship with the government and government agencies. So again, when we are engaging with this population, we should be very transparent, very welcoming, explaining, the expectations, explaining our roles, the agency roles, and how we're there to support them. It's very important so they feel they can trust you as the service provider. So hopefully all these tips about the Latinx community gives you a little bit more understanding in your practice so you can provide better services. Um, Again, as in order to provide cultural responsive services, we need to have a better understanding of the clients that we're dealing with, where they are coming from, who they are, why they behave in the way they do, why they think in the way they do, why they do the things that they do. Understanding the why behind their behaviors is important so we can be more mindful of the services that we provide and of course more understanding because sometimes it's challenging as providers to offer services, create a plan for them, engage them, refer them, and then people don't follow through and we feel frustrated. But when we understand the cultural norms behind them and their backgrounds, we are able to understand a little bit better why they behave in the way they do. So that take us to this important point about exploring my own bias against the Latinx community. I'm going to give you a few seconds for you to think about if you have ever, if you are aware of any biases against the Latinx community. You can even write it down on a piece of paper or and just think about it. Have I ever had any bias when working with this type of population? Okay, it is okay. First of all, I want to say something. We all have biases. It is part of being human. It is part of being who we are. We grew up in different cultures, different communities, influenced by different ideologies. And it is okay to have biases. It's I mean, more power to you. You don't, that's okay as well. But as a practitioner, I have my own biases. There's nothing wrong with having biases because, again, that's part of who we are and how we were raised. Um, However, when we're providing services, it's super important that we are aware of those biases so they don't impair our ability to make assessments, to provide services, to engage with our communities. Um, so there are two type of biases. We have explicit or conscious biases. Those are the biases that are overt. The person is aware of them. They are processed neurologically. They are expressed to negative behaviors, like maybe discriminatory practices, physical or verbal harassment, microaggressions. So they are out there, right? Probably we are not here. Maybe we have, and that's okay. In the past, we've done it, or sometimes we do. Um, but I think explicit biases are more because we are aware of them. We are more able to control them. The problem are the implicit biases, unconscious biases. They are outside the person's awareness. They even contradict our own values and beliefs. Like we don't think like that. We don't hold those beliefs. We don't hold those values, but they are there. They can interfere with clinical assessment, decision making, and provider patient or provider client relationships. Okay. So I would like to share with you. Um, I used to have a bias against teenagers. I grew up thinking that, and I was always told, oh, teenagers lie, they lie. So I grew up thinking like this. And when I had to work with teenagers and they were to disclose, their abuse or their issues, I was like, I was always in my head questioning, are they lying to me? Are they trying to get their parents in trouble? Are they trying to get, out of school or out of doing some assignments? What is up to them, right? And when this became an issue for me because I had to work with a lot of teenagers and I was always questioning them. So I had to go talk to my supervisor, and that's when I explored with my supervisor that I had a bias and I didn't know about it and I wasn't aware of that and I wasn't telling everybody about my bias. And that implicit bias or unconscious bias became a explicit bias. And I think I still do have a little bit of hard time working with teenagers, but because I'm aware that I have a bias, I have it in the front of my head. And if I have to work with a teenager, I'm always more conscious of my words, of being more understanding, um, showing empathy. And if I need to process something, I will always consult with my supervisor about it. So this is what we need to do again, and we could go. I shared this example with you just to let you know that it's common that we do that. It's common that we have biases, and if we were to have the opportunity to talk to you about the specific work that you do, probably you have biases there. If you do, let's work through those. Okay, let's write them, like let's identify them, write them down, so you know they are there. And when you are working with your families, you can put that on the side, or be aware that they are not going to interfere with your ability to make good decisions, um, that that for your families, for your clients, for the people that you're working with. And now we're going to move to practicing from a trauma-informed care approach. Okay? Having a better understanding of the culture and having a better understanding of myself as practitioner, as provider, no matter what role you have in your organization, All organizations are shifting from traditional practices to a trauma-informed care approach. Traditional practices were like before, we were more disconnected. The agency was on one side and the client was on the other side. We didn't have a lot of communication with other agencies. That was like the traditional approach of providing services. People show up, they receive the services, they went home, and that was it. Now the approach is changing. Now the perspective is changing. We're moving to put the client in the center, and we surround the client with services. We interconnect with other agencies. We talk to other providers. We help the client to come up with their own solutions instead of me providing the solution or the diagnosis or the treatment plan or for them, right? But we now involve the client in this process. So, trauma informed care promotes healing by fostering an alliance of human connection to build trust and resilience. This is important when working with our clients from the Latinx community. They come from a background, again, of a lot of trauma. A lot of people immigrated here to the US because there was a lot of political issues, there was a lot of violence in their countries, poverty, a lot of social issues. A lot of people came here not by choice, but force due to all these situations. They come here and they have a baggage of a lot of trauma. And this is what we refer to as historical trauma. For generations and generations, these countries have faced all these social and political issues. And this trauma is passed from one generation to the next, historically speaking and socially speaking. So when they come here, they come with that baggage. Even if they are second or third generation here, born here in the US, they still carry on their shoulders a lot of the trauma from their previous generations. And also, we have a lot of what is called intergenerational trauma. That's the trauma that goes in families from generation to generation. So when you are providing services to a Latinx member, a Latinx person, you have to understand their family, where their family come from, where they come from, where their family come from, and what trauma did they face. This is important because we want to promote a healing environment. We want to develop an alliance, a therapeutic alliance. And when I'm talking therapeutic alliance, and if you maybe, oh, I'm not a clinician, I don't provide services. Maybe you're an administrator. Maybe you are a person of support staff. Maybe you are the security guard at your organization. No matter what role you have in your organization, we all should provide services from a trauma-informed care approach. We always want to develop an alliance with the client. From the time the client comes into the door, we want to make sure we are welcoming, we are building that trust, we are providing a safe environment for them so they can explore their resiliency and they are open to services. We don't want to re-traumatize our clients. We don't want them to come to receive services and then feel discriminated against, feel disrespected, or feel unheard, or feel that they are nobody, they have no voice. Because again, they come from a background of a lot of trauma, historical and intergenerational. And most of the time, they don't even know. I have the opportunity now to run the Spanish speaking support group at Kaiser, and I get a lot of clients. And when we talk about trauma, this is new for them. They didn't even know that all these events that they went through were traumatic events. They just grew up like that. They just have to go through that, and they don't even know that that trauma has a lot to do on how they behave and the mental health illnesses they have developed. So we go back to trauma-informed care approach, okay? We want to avoid any disempowering dynamics in the helping relationship because they can be re-traumatizing. And that's why all organizations are shifting to provide trauma-informed care because we want to ensure that our clients feel safe when they are asking for help when they come to receive services. So what are the principles of trauma-informed care approach? First, safety. Again, when we provide services, we want to ensure that our clients are feeling safe. Most of the time, clients don't want the services. There is a lot of stigma in the Latinx community about mental health and behavioral health services. Um, they tell me, oh, I don't like being called crazy. I don't want my family to think I'm crazy and I'm coming to see like a therapist, and it is hard for them. So we want to ensure that they feel safe. This is a safe environment. You can be you here. I'm here to listen. I'm here to support you. I'm here to empower you. And I'm here to respect who you are. Okay. So that's the safety that we want to ensure that we provide. Not only psychological safety, but also physical safety in the service environment. Then the other principle is trustworthiness and transparency. Again, remember we talk about a lot of us represent government agencies, and Latinx members, they have a distrust of government agencies. So we want to develop that relationship. We want to keep the clients informed. We want to introduce ourselves, introduce organizations. We want to be open with them. And in my work as CPS or CFS social worker, I had to make difficult decisions like removing the children from the home. That was not an easy decision to make. The sometimes or most of the time families did not welcome that decision, so it was hard to develop that transparency with them. Or sometimes when they come to my to therapy and I have to provide a diagnosis, and they are now very welcoming of that diagnosis. It is hard those are hard conversations, but it is important to be open and transparent. It is important to the involve the clients, their family, their support system in the decision-making process. We don't want to make decisions and just pass it on to them. Oh, this is the decision, or you have been diagnosed with this, or you have to complete these classes, or you have to do this. But there is no explanation. There is no space to answer questions. So that is part of the transparency process. The more we are transparent with our clients, the more they are open and willing to work with us. Another important element is the peer support. Um, um, Individuals with trauma, who have experienced trauma, are very critical partners in the healing process and recovery process. So if we want to make sure that we develop a support system around our clients, our families, our communities. We don't want to work for them to be working on isolation. As a lot of times people come, we provide services, and they don't have anybody. And you ask them, who helps you when you have an emergency? I have nobody. And that could be the reality for some of them. Sometimes they are just ashamed or sharing what's going on with other people. So we have to work on developing that support system for them. It is important that they have connections with other people. If they don't have any family members, then we have to connect them with other organizations or people in the community who can be a support to them. And also for us as providers in any role that you are fulfilling right now in your organization, it is important for you to reach out to your peers for support. It is hard to do this job by ourselves. So having that peer support is super important. And that takes us to collaboration in mutuality. Everyone in the organization plays an essential role in providing trauma-informed care services. Everybody. And I know we have different people here today, and you all play a very important role within your organization. You have different assignments, you have different jobs to do, missions to accomplish, projects to develop, um, offices to manage. But in your role, eh, you play an essential part of the whole process, and you have to provide, and it's my hope that you do services, and I'm not talking direct services like one-on-one services with your client, but again, from your role, from a trauma-informed perspective. Let's say you are an administrator and you have to develop a new program. So let's include these trauma-informed care elements in the new program that your organization is going to develop. Let's say you are the person who does the intakes over the phone or schedules the appointments. Well, it is important that you provide, when you engage with the clients, you do it from a trauma-informed care and they feel heard and welcome. Sometimes I have clients or patients who come to me and they say, oh, the person on the phone was rude to me. I didn't want to come to see you because I thought everybody here was rude, right? And that's the because that's the first impression. So that's why it's so important that everybody in the organization is working towards the same mission, providing trauma-informed care. Let's move to empowerment, voice, and choice. Building on clients' strengths, again, when they come to us for help, they are probably not having a good time. They are going through a difficult situation, but we want to focus on serving the client. So help the client to develop resiliency and ability to heal and recover from trauma. Okay. And finally, cultural, historical, and gender issues. I think we already touched a lot on the importance of respecting and understanding, first understanding, learning about the culture, and of course, respecting the cultural choices and cultural backgrounds. Okay. We also want to offer gender responsive services. We want to incorporate policies and procedures that respond to cultural needs of the Latinx community, recognizing and addressing the historical trauma. And this is not an easy fix. It's not something that you can do overnight. You can go back today and say, I'm going to start implementing this. I'm going to start doing this to help my community or to help my clients from a Latinx Hispanic background. But this is not a change that's going to happen overnight. I think all of us as practitioners and members of the different organizations have to work together to make this change happen. As I told you before, in the Latinx community, trauma tends to be transgenerational, and there is a stigma associated with seeking services. And unfortunately, as of right now, we don't have a formal screening for trauma, and so it's more when you talk to your client, when you assess that you develop that insight, and it's like, oh, the person has suffered from this traumatic event. So trauma is more prevalent in impoverished and isolated communities, and Latinx communities are isolated and have more difficulty accessing services and social support. Okay. It's also important to remember that Latinx distrust the system because of previous negative negative experiences with the system. So unfortunately, some Latinx communities and individuals continue to be exposed to the source of trauma. And a lot of families don't want to talk about it. A lot of families just want to handle it within their own family because that's very important in their culture. And so sometimes people normalize the trauma exposure with their own families and communities. And it is very difficult to break the barrier. Older generations, Latinx, older generations have been exposed to traumatic experiences are less likely to engage in services or support services offered to younger generations. So we have to, all of these are very important points that we have to have in mind when we're dealing with the Latinx community, how we can incorporate all of these key points that we have learned today to provide better services that are more culturally sensitive, but not only that, that are more effective. Because at the end of the day, we want to ensure that we provide services that respond to the needs of our clients or our families, but also that they are making a difference. And we don't want to stay with the families forever. We want to come in, we want to provide services, and we want to give them the tools for them to be able to go back and have a better life, to heal from trauma, and to be able to achieve their goals in life. We don't want to be in their lives forever. That's what I tell my patients when I talk to them during the intake, when we do clinical work. I'm like, I'm here for you. I want to help you to heal from your trauma. I want to help you to develop skills so you can be on your own and have a happy, meaningful life. So that is the purpose, right? Sometimes it's not possible when we deal with ongoing issues like substance abuse or ongoing like higher um, diagnosis with like schizophrenia, bipolar disorders, or other diagnoses that maybe we know they're not going away. But again, how can I provide you tools that can help you to have a good quality of life? So I hope all of these tips can you can bring these tips to your organization. You can talk to colleagues, you can talk to your supervisors, say, hey, I learned this from this webinar and I would love to implement this. Or in my own practice, in my own role, in my organization, I just want to do one or two things differently to approach better the Latinx community and to serve them better. So I'm going to give you a couple examples from trauma-informed practices that you could, just to give you an example, if a worker is told to complete an assessment with a time frame which requires asking many sensitive questions quickly in a first interview. So a non-trauma informed approach will be the social worker or the practitioner or the clinician sits behind her desk and typing information into a computer during the first interview, asking client to comply with the assessment. And even if the client feels afraid or a little bit guarded, but you have to do what you have to do. You only have 45 minutes to do it. How can you do the same thing from a trauma-informed care approach? Well, you sit with your client, you explain what's going to happen, you ask open-ended questions, you validate the client's feelings, you build rapport with the client to elicit information by allowing the client to share at his or her own pace. You could be like, oh, do we have the time to do all of that? Sometimes we think we don't, but it could be more effective if you spend a little bit of minutes at the beginning building rapport, engaging the client, trying to get the client to trust you, and it will be easier to elicit that information instead of you dealing with a very guarded client who is not willing to provide information because it is afraid. So it's just an example of how we can provide the same service, different approach, and of course, different results. For another example that I want to share with you, a social worker or a clinician, a protection practitioner tries to run a counseling group with women in substance abuse treatment, but gets frustrated with the client's silence and resistance to meaningfully participate. That happens a lot when we run groups, right? A non-trauma informed approach, the traditional approach, the group room is um, the traditional approach. You do your group. If they don't participate, it's their problem, their issue. They are not the ones engaging. The room is kind of has bare walls, hard chairs, harsh lining, and we don't even care about the environment. We just care about running the group and be done with it. That will be the the traditional approach, right? We just have to do it. But trauma-informed care approach in this scenario, maybe the social work as the administration for some petty cash. So goes to the store, decorates the room, makes it a little bit more inspirational with posters, maybe a lamp for the lining, and makes the room to feel a little bit warm and welcoming. And so when we talk at the beginning about trauma-informed care approach, we're talking about physical and psychological safety, okay? Sometimes our offices, yes, we don't have a lot of money to expand in and beautiful decorations, but we can make it a little bit more welcoming, more warming. Remember, our clients come from a background of trauma. So coming to a place where they feel safe, not only emotionally, but also physically, is very, very important. Um, Administrators, if you're listening to this webinar, directors, you have more saying on how the resources, financial resources, are utilized. And sometimes we don't pay attention to these details, like the decorations of the rooms or the places that where we provide the services. This is also important. So all of these are tips for you to think, oh, from my chair to from my assignment, I can make a difference. So working with the Latinx community could be challenging because they come from a very diverse background. And the culture is very rich and very complex. So have that in mind. And please, please be open to learn more about the culture, be open to engage the Latinx and Hispanic clients. And when you provide services, remember they come from a background of trauma and they're looking for safety, for comfort, for healing. And I'm pretty sure you can provide that to them. It has been a pleasure, and thank you so much for participating in this webinar.